Jack Chambers. The Deputy has 4 minutes to make his initial statement.
Thanks, Cathaoirleach. Minister, I'm raising a matter of what I consider of extreme importance today that impacts on patients who are waiting for a cardiac procedure called a transcatheter aortic valve replacement. It is the replacement of an aortic valve in a less interventionist way than open heart surgery, and so the aortic valve is replaced by a cardiologist rather than a cardiac surgeon. The valve is replaced through femoral or other arteries instead of open heart surgery, as I've stated. The reason patients require this type of cardiac intervention is that open heart surgery has been medically assessed as being inappropriate due to the underlying medical conditions for these patients. For example, some of these patients have quite severe cerebrovascular disease, they've got renal disease, they've got arterial disease, they've underlying respiratory issues or even haematological issues, and they cannot get the intervention via open heart surgery, which was the historic means to make a cardiac intervention, and that isn't possible for a lot of patients. So this transcatheter aortic valve is the solution for these patients. But a lot of these patients, as we've discovered, well, I've discovered through constituency representations, they're not getting the intervention that they need and deserve. And the situation as it currently stands in the Mater Hospital is an absolute illustration of total and complete management dysfunction. It is an illustration of the complete dysfunction of the Ireland East Hospital Group and the short-sighted, irrational and clinically dangerous allocation of resources within our health service. The information I have received is that there are up to 18 patients who are clinically unwell and sick, as I've mentioned. They're not clinically able for open heart surgery, and they're assessed as needing this valve replacement in the Mater Hospital. They have complex medical and cardiac needs, and time is absolutely of the essence. The barrier, however, for them getting their required intervention is not a staffing issue, it's not an issue with theatres, it's not an issue about bed capacity. We have the doctors, we have the nurses, we have the theatres, as I've said, we have the hospital, we have the beds, but we don't have one thing. This state, this health service, the HSE, your department and you as ministers will not fund more than 2 valves per month. The consequence of that for lots of patients is that they're becoming clinically unwell, they're sicker, and their lives are at risk as a result of an unfair management practice. It is the refusal by the HSE and by extension your department and ministers to fund more than 2 of these procedures per month within the hospital because of the costs of the valve. Patients are left lingering for months with their lives at risk and their health deteriorating. A rigorous, irrational and completely unreasonable budgetary approach to these transcatheter aortic valves mean medical and health teams that are already in place cannot make the intervention they are paid to do. Why? Because they cannot make the intervention they're paid to do because you as ministers will not fund the equipment and the HSE as the service provider. Many of these patients, as a consequence, are in our hospitals being managed medically because their underlying symptoms are worsening and they cannot get the valve. It's the most unreasonable and irrational method of allocating funds, and the valve, whilst it costs more than open heart surgery, it's regressive as in terms of our health policy to limit the quantity of valves when we have the teams in place. We've spoken about recruitment issues in our health service. This isn't an issue. The staff are there to do it, and they've been telling the patients they will do it. They have the theatres, but the HSE will not fund it. And I urge the Minister to address this. Thank you.
Thank you. Minister, 4 minutes to reply.
Thank you very much, Cathaoirleach. And I want to let you know, Deputy Chambers, that I'm taking this debate on behalf of my colleague, Minister Simon Harris, who has asked me to extend his apologies to you as he's unavoidably occupied elsewhere. But it's also a good opportunity to give us an opportunity to update the House on the transcatheter aortic valve implant procedures, also known as TAVI procedures, in the Mater Misericordiae University Hospital, as raised by yourself, Deputy Chambers. Aortic stenosis is the most prevalent valvular heart disease and the 3rd most common cardiovascular condition after coronary artery disease and hypertension. Many patients with advanced aortic valve disease are too high risk for traditional treatments such as open chest surgery due to advanced age and coexisting medical conditions. Catheter-based techniques such as TAVI are therefore hugely important as they provide an alternative method for treating aortic stenosis in patients with unacceptably high surgical risks. TAVI procedures are a relatively new development in Ireland, with the first case performed in 2008. In addition to the matter, a TAVI service is now provided in St James's Hospital, Galway University Hospital and Cork University Hospital. I understand that funding arrangements to date facilitated a limited number of these procedures to be undertaken each year. The HSE have advised me that so far in 2016 at least 19 TAVI procedures have been completed at the Mater Hospital. And the HSE have also told me that the Mater manages waiting lists with due regard to the complexity and urgency of the cases presented. Further development of the TAVI service will need to be considered as part of the 2017 estimates process now underway in the context of overall competing priorities and demands for health service funding. In relation to waiting lists for this service and for all health services, I want to emphasise that improving waiting lists for scheduled care is a key priority for the Government. The emphasis of the programme for a partnership government on the need for sustained commitment and funding to improve waiting times for patients is evidence of this. However, I am aware that waiting list data for June 2016 shows that waiting list numbers increased nationally in the first half of the year. And Minister Harris met with the HSE National Director for Acute Hospitals on Friday last, the 15th of July, regarding proposed measures to tackle waiting lists. He has asked the HSE to submit an action plan setting out the specific measures it proposes to implement with hospitals within current resources between now and the end of 2016 in order to achieve tangible improvements in waiting list management. The action plan will focus on measures to improve hospitals' processes in managing waiting lists, validate all waiting lists, as well as target those specialities and hospitals with the highest number of patients waiting. I want to emphasise this Government's determination to address undue waiting times for all those in need of our health services, including TAVI procedures, and I am confident that good and steady progress on waiting lists overall can be achieved in the months ahead.
Thank you. Deputy Chambers.
I'd like to thank the Minister for the response, but what you told me, you reiterated what I told you about the issue around aortic stenosis, how medically complex this is. Then you mentioned how you fund some of them and how there's limited funding for it. And then you gave me a summary from some manager about what they're doing apparently to address waiting lists when they've rocketed this year. But you didn't address the specific question around these TAVI procedures in the Mater Hospital. And all that is management lingo. You spoke about the 2017 estimates. That will do nothing for the 18 patients who are waiting today for this procedure. They don't have 6 months to the end of the year to actually survive this. That's being real about it. You've given no commitment to address the current chronic issue of not funding the piece of equipment. Let me give an example. There's one patient in my constituency. He's been in the Mater Hospital for a month. Cost of a bed, £1,000 per day. He's going to be there for over 2 months. That could equate to £60,000 for the state. The valve costs £22,000, and there's negligible staff costs because we already fund them. But the problem we have in this health service is that we see the bed capacity issue. They see him as a fixed cost. He can stay in the bed. Managers aren't necessarily concerned with his medical outcome, because if he gets the clinical outcome and the procedure, someone else will replace him. So there's no incentive within management to actually see clinical progress for patients, to actually cut the waiting list. They don't care whether he's in the bed any longer, because they've left him there and they've focused on the estimates, the costs. The fact of the matter is the clinical outcome for him can be much improved, and for others, if they're given the valve, given the procedure, and then they're discharged from the bed for someone else. But instead we're leaving him the bed, which is a cost to the state, to the detriment to his health and to the detriment of our overall health service. And the 2017 estimates and the management lingo around what you're doing about action plan around waiting times is nonsense. It won't address this specific issue that we have in the matter, which is rigorous and irrational management procedure around the funding of a basic piece of equipment when we're already funding all the additional costs. And as government, you need to tackle management to stop this, and I urge you to do it now.
Thank you, Deputy Minister.
Very much. Thank you very much, Deputy Chambers, and it's clear to see how exercised you are about this very important topic, as we are. As any minister in a Department of Health would obviously like to see the €14 billion of taxpayers' money that's being allocated to the HSE, to see that it's being very well spent. And that is why we are taking waiting lists, including this particular waiting list, so very seriously. I mean, Minister Harris and the Department are actually engaging with the HSE to establish how these waiting lists can be reduced. I mean, it's very interesting to see, the kind of numbers that we're dealing with overall. I mean, if you look at the amount of people that are attending, say, for example, outpatients, there are 3.2 million outpatient attendances at our hospitals, but it's part of the overall picture of waiting lists. And I'd like an opportunity to respond. Deputy Chambers, you're a new deputy here, and I've thought that the least you would do is afford somebody the opportunity to answer to the chair. Yes, that Deputy Chambers might also afford me the courtesy of speaking through the chair, which would be very helpful. In fact, his behaviour hasn't changed since the very first time I encountered him in the chamber here when I was in your position, Deputy. In any case, but there'd be no harm now to do a little bit of an induction course for some of them. The overall budget of the HSE is €14 billion, and they've also been allocated, because you alleged that they weren't being adequately funded. They have received another €500 million approved just last week in terms of increasing their budget. So yes, certainly there is something wrong with what's happening in terms of management of waiting lists. We all wanted to get to the bottom of it. You're not the only person who cares about this. Sorry, he is not the only person who cares about this, Cathaoirleach. And I want to reiterate that we are taking this matter extremely seriously. And I know that not only are there waiting lists in the hospital he refers to in the matter, but there are others elsewhere that we want to address as well. But let us be given the opportunity, because remember, the party that the Deputy is a member of caused the financial crash, which put us into the financial mess that we are in, and we are now trying to come out of it and do a very good job to give back to the people of this country the type of health service that they deserve.